Let's come back to Omaha now, listening on KKAR. Larry, you're on with Senator Nelson. Go ahead.
Hello, Larry.
Yes, thanks, Senator. I'm calling about the Obama health care plan that I believe your vote was a rather decisive vote in favor of that. And I'm wondering if you would still agree that your vote was the proper one.
Well, I guess the question you have to ask is what would happen if we didn't try to reform health care? When you've got health care costs going up at the rate of double-digit each year, recognizing that at some point, unless something is done to control those costs, there's growth in those costs, that everyone will be priced out of the range except for billionaires. Healthcare reform was absolutely necessary to slow the rise in insurance premiums, care for the uninsured, which you and I pay. If you have insurance, it costs us about $57 billion a year. That's over a 10-year period. That's almost $600 billion that is costing us if we don't have health care coverage that's for individual. There were 106,000 Nebraska children with pre-existing conditions like asthma or diabetes, and they're now being covered by insurance. There were 26,000 Nebraska seniors who hit what's called the donut hole in their prescription drug coverage. Now that is being the size of their donut hole is being reduced so that ultimately they're not going to be out of pocket. There were 7,600 Nebraskans of college age up to 26 who can now remain on their parents' plan until they can get their own coverage. It goes on and on and on. And there are 239,000 Medicare recipients in Nebraska, insureds, who can now receive free preventive services and diagnostic care. So, if you don't think that these are benefits that are worthwhile, then I can understand why you would be opposed to health care reform. But if you think that these are important things to have done, then it's pretty hard to be against health care reform. So, no, I wouldn't change my vote.